Good evening and welcome to Aging Matters, a program hosted by Berks County Area Agency on Aging. Our office is located at 633 Court Street on the 8th floor in Reading. You can obtain information about our services and programs at www.berksaging.org or by calling our office at 610-478-6500. My name is Carmen Colon, and I am the Community and Outreach and Education Coordinator. And we have a very interesting topic today. May is Older Americans Month, and during this month, we recognize older Americans for the contributions, for the groundbreaking discoveries, and they're pioneering the new industry. So by recognizing them and providing them information, we have this beautiful month in May to bring out all this information to them. Older Americans Month theme is Safe Today, Healthy Tomorrow. And today's topic based on Older Americans Month is in charge of your health. We want the older Americans and the seniors in general, and the population in general, to live longer, to be healthier. And when I thought about this month, I thought of my guest today. I thought of Yolanda Jimenez-Colon. And Yolanda, she is the Senior External Affairs Associate with Gateway Health Plan. Thank you for being with us today, Yolanda.
Thank you for having me. It's my pleasure to be here.
Thank you. Yolanda, when I think about the Older Americans Month and the Safe Today, Healthy Tomorrow, I know there is the injury prevention, falls prevention, but I also think about when you're feeling sick, you're feeling ill for 1 day, 2 days, or prolonged time. You go to the doctor's office, you sit there for a long time, and then once you get to the doctor's office, guess what? Oh my, I forgot even why I'm there.
Yes.
You know, at times. And the funny thing is that once I get there, you know, you wait sometimes real long in the waiting area, and when you get to the office, when you get right there in front of with the physician, sometimes you forget the questions and you forget so many things. And when you leave, you're like, okay, so what do I have? What prescriptions I'm taking? You know, so that's why I'm so happy you are here with us today during our program at Aging Matters, so we could go over some of these details.
Great, great, great. Well, once again, thank you for having me. I think it's very important for us to know that we need to take charge of our health.
Yes.
To understand that we have the right to ask questions. And when we understand that when the balance changes a little bit, we can have better control. We can be the CEOs of our health.
Oh.
And when we talk about being the CEO of our health, we're not only talking about a disease-specific topic.
Okay.
We're talking about holistic, right?
Okay.
We're talking about an integral approach to our health. So that's why at Gateway Health, which is a managed care organization that has been around for over 25 years, and here in the Philadelphia area, we've been for 2 years. It's important that we understand and we talk to people and we let them know how they can be in charge of their health.
And that is so, so, so important, because it helps us live longer when we know exactly what to do, how to take control of our health. This will help us prolong a healthier, longer life.
Absolutely, because you know what we find is one of our focus area, Gateway Health focus area, is health literacy. And health literacy is just plain the ability to read, understand, and act on health information. If we can't understand the information that we're given, we can't make good choices because we don't understand the information. So it is important that the patient asks questions, and it's also important that the provider understand that health literacy is important, that we are in the business of keeping people healthy or preventing things. And how can we do that? We need to work together as a community and make sure that we ask the right questions. And I'm going to go into asking some of those questions in a bit.
Okay, great, great. Yes, because it's very important, and I know the audience, they like to have the papers and pens ready, and I'm sure they'll be writing some of the questions.
Great.
So when they go to the doctor, see their physician, they'll be able to, they say, wait, this is one of the questions that I should be asking my physician.
Absolutely. And you know, it is so important to ask those questions because the healthcare industry is just very complicated. The system itself is very complicated. So we are at risk. We're at risk when we get medication. We're at risk when we get all the information that we're given. So if we don't understand that information, we are at risk. The people are taking more and more medication every day. I had a presentation that the person who was taking the least was taking 6.
Wow.
So you're at risk. You can take the wrong medication, you can take the wrong dosage. So if you don't understand that information, you're not going to be able to be the CEO of your health and take charge of your health.
That is so true. Yeah, that's so true. Absolutely, yes. So, the viewer, if you have any question, remember this program is live. You can contact us here at 610-378-0426, or you can contact also Yolanda at 215-316-1898, or you could call our office at 610-478-6500, and we will refer you to Yolanda and provide you also with some information that you have available. For example, like this pamphlets that you have, and I've been at presentation that you have done here in Berks County, and there has been have been a lot of questions. So Yolanda, in order for them to take charge, what's the first thing in order for us to take charge? What should we do?
Well, I want you to prepare. When you go to the doctor's office, even before going to the doctor's office, you need to understand what you can do. So what can you do before going to the doctor's office? While you're at the doctor's office, after you leave the doctor's office, there's several things that you can do. And why is this important? I'll give you a quick story.
Yes.
We had someone who went in to the doctor's. She had to get a hysterectomy.
Okay.
She had the hysterectomy done. She was of childbearing age. So she went, got married, was trying to have children.
Oh.
Remember, she had a hysterectomy done.
Yes.
So she went back to the doctors to ask the doctor why couldn't she have children. The doctor asked and said, well, didn't you understand what a hysterectomy was? She clearly didn't.
Yes.
Well, the doctor was supposed to explain. And she was supposed to take charge of her health and ask questions. Sometimes we feel embarrassed, or we get what it's called white coat amnesia. And
what was that?
White coat amnesia. Where we, you know, when we see the doctor and we're like, oh my God, the doctor! I'm so nervous, and your blood pressure goes up, and you know, there's ways that we can take charge of that. And so, you know, sadly enough for this woman, the doctor assumed that because she was well dressed, she understood what was having a hysterectomy, the side effects of having a hysterectomy, and that wasn't the case.
So it's very important to ask thoroughly and make sure before you leave the doctor's office to know what procedure you're having done, what you're having.
Correct.
If you're not clear, should they ask again?
Absolutely, absolutely, and we're going to go through that. So what do you do? What can I do before the visit? So I want you to prepare questions.
Okay.
It's very important to prepare questions, to write down your symptoms. Sometimes you have symptoms and you call the doctor's office and you can't get into the doctor's office until 2 weeks from now. So in 2 weeks, you're probably going to forget what were your symptoms.
Exactly. You waited so long and finally you have that appointment that you was willing and you was anxious to have.
Absolutely. So you know, you might forget those symptoms, or if you don't write those symptoms out, you don't know if those symptoms could be underlying a bigger disease or a bigger problem. So it's very important to do that. Also, decide how you're going to get to your appointment. I tell you another quick story. I love quick stories because I get these stories from presentations that I do, and people that just come up to me and say, hey, this happened to me. This lady, she had an appointment. And she did not know the doctor or how she was going to get to this doctor. The appointment was the next day. She was stressed.
The next day. Wow.
She was stressed. Her blood pressure went up because she didn't know how she was going to get to the doctor. So I tell you to please prepare ahead of time.
Ahead of time. So probably one advice would be, or
decide how you're going to get to the doctor's office. If you don't know, call. Maybe there is transportation. Gateway provides transportation for their members. So maybe there is.
Is it free?
For members, yes. For members,
Great.
yes.
So there you go.
Absolutely.
That's another way of.
Yes, there's a lot of benefits that someone, a marketing representative, can answer those questions if people want to know a little bit more about our benefits. And yes, transportation is one of them for our members. But know how you're going to get there. Ask for a phone number. Ask for a map. Ask for public transportation. Ask a friend or a family member. Hey, have you been to Dr. So-and-so? What can you tell me about Dr. So-and-so?
Exactly.
You want to be in charge.
We have to grade them also.
Absolutely.
So we have to make sure, you know, that we feel comfortable to seeing this physician that we are going to.
And you build a relationship with your doctor. If you feel embarrassed about asking questions, there's something needs to be done because you want to make sure that you have an open relationship with your doctor, a relationship that you can ask questions, that you can leave there knowing and understanding, and that you're making the right decisions, right?
Yes, exactly. And also based on the transportation, going back to the transportation, you'll be less stressed.
Absolutely, absolutely. This poor person, her appointment was the next day, and she didn't know how she was going to get there. So it's really, really important that we know how we're going to get there. Another quick thing is talk to friends, talk with friends and family members. Once again, they probably have gone to the same doctor you're about to visit. It was your first time. Ask them to be honest and open with you. Hey, did you like that experience? Were you able to ask questions to that doctor? Did he or she take the time with you?
And that's very important.
Absolutely, absolutely. Also, prepare a list. Prepare a list of medications. It's key. You want to prepare a list of prescribed medication, prescription medication, over-the-counter medication, and herbal medication.
Exactly.
It's very important. So you're prepared. You're taking charge of your health, and that's what we want everyone to do. But especially our older adults, we want them to take charge of their health, or have someone who can help them to take charge of their health.
Have the caregiver. On this note, we're going to hold that thought. And we are going on a break, and we'll be right back.
You're watching bctv.org. Be informed, be involved, be a member. For membership information, go to www.bctv.org/support/membership. For other stories and information, go to bctv.org.
Welcome back to Aging Matters. Today's topic is in charge of your health. And our guest is Yolanda Jimenez-Colon, and she is the Senior External Affairs Associate. And we have been involved in this very nice conversation on how to be in charge, how important it is for you to be in charge of your health. And Yolanda, so based on that,
so we were talking about what to do before you go to the doctor. Well, now let's talk about what you can do while you're at the doctor's office. Gateway Health makes sure that we put emphasis on health literacy. And that's why we come in these shows and we bring information that is valuable to our members, to our viewers. So it's really important to, during the doctor's visit, ask questions, right? Bring a friend or a family member. Remember, if they can help you take notes, if they can help you with the information, that is great.
Now going back to the asking question, sometimes we feel a little bit, I could say shy, and we don't dare to ask certain questions. Is this okay, or can I take my questions all written and give it to the doctor and say, this is what I want to know before I leave the office?
Good. You need to take charge. You need to take charge, and you need to ask questions. Do not be afraid to ask questions. Your doctor should encourage you to ask questions, and not only encourage you to ask questions, but he or she should listen to those questions and should have an answer for you. And if he or she doesn't know or doesn't have an answer, make sure that they find information for you that you can take home, that you can read, that you can watch if it's a video. There's different tools that our providers or doctors can provide the patient to make sure that they understand the information that they're given. Also, you want to ask for photocopies. Ask for photocopies of any helpful information the doctor has. For example, if you're going to the doctor's office for a flu shot, ask for a sheet of information. What does that flu shot contain? How many times am I supposed to take it? What is the risk if I take that flu shot? So it's important to take charge and to ask those questions.
And there are, like you said, many tools nowadays, like the internet. That's a fabulous thing nowadays, where you could get a lot of information, but the most appropriate way of getting your information is directly.
Absolutely. Have that relationship with your doctor, because unfortunately, the internet is a great resource, but a lot of times the information that a patient might get might not be the correct one. Or because that patient might have different diseases or different things going on in their body, the information that they're getting might not be the information that is suitable for them. So have a relationship with your doctor.
Great. That's very important.
Absolutely. Now, you can also ask for photocopies of any test results. If you've had an x-ray, ask the doctor to provide you with a copy of those x-rays. You have the right to. Remember,
that's right,
you know,
we're taking control of
our
health.
You know, if you have with Gateway Health, the product that we have here is Medicare. If you have insurance, if you have Medicaid or Medicare or a private insurance company, your doctor is getting paid. So your doctor works for you, right? So when we change that balance, and we have fabulous doctors that want to answer your questions, that are passionate about their profession and passionate about helping their patients. But we also have, you know, doctors or professionals that, you know, you're in and you're out. And that's why it's so important for you to take charge of your health. So make sure you ask those questions. Make sure that you feel comfortable enough with your doctor. Also, if you have those test results, save them. How many of you have been to the doctor's office or to an appointment somewhere else, and they can't find your documentation, or maybe you fax it to them and they can't find it? It has happened to all of us. But if you take charge and you make a copy and you have it and you save it, there you go. You have it. Less stress for you.
Yes, and you know what? So I for example, myself, for example, when I get these test results and I do ask for the copies, I'm able to compare the results from my last test and how I was doing, and it will help me also to make wiser decisions. To, you know, take more control of my health and know if I'm progressing or if I'm declining in certain areas. And also it will help me that when I go to the doctor, ask, okay, why is this lower? What can I do?
Absolutely. And we're mentioning the doctors, but this goes with the therapist. This goes with your pharmacist. I mean, this goes with anyone that is helping you take care of your health. You can use this information with anyone that's helping you take care of your health. Well, it's important to also ask the doctor to repeat the information. It's important to ask them to repeat the information, because if you can repeat it back to him or her, most likely you understand that information.
And for sure, when you leave his or her office, you'll have a better picture, better understanding of what's going on with your health.
Really quickly, what can you do after the visit? So you've done your homework before the visit, during the visit, now after the visit. You want to tell a friend or a family member to have the information as well with you. Remember, when you can repeat the information in your words, you can understand it. Really quickly, what questions? I'm going to give you 3 questions really quickly of what can you, what are the most important questions that you should ask your doctor or your provider when you're seeing him or her. Remember, health literacy. We want our doctors to speak to us in plain language, plain living room language, the information that we're sharing here, because that's how we speak. You know, we don't want him or her to speak in their terminology. The point is, we want to understand.
And remember, also, this is very helpful because we have a huge population of seniors that are 60 and older. A lot of them that did, you know, had the opportunity to go to school and have the schooling in their background. But some terminologies that are used by the physician or doctor, sometimes they cannot comprehend, they don't understand.
Yeah, or I did a presentation yesterday where the gentleman said, you know, I've been going to this doctor, this was a new doctor, and he was telling me information. you know, I couldn't hear it because I didn't have my earpiece on.
Wow.
So he couldn't hear it. The doctor did not take the time to you know, make him comfortable for him to let him know, well, hey, I have a hearing aid. Can you please speak louder? I left my hearing aid. Can you please help me? Really quickly, Carmen, I want to make sure that people use the three following questions that I'm going to present to you. So what is my main problem? You want to ask, what is your main problem? You can ask this at the doctor's office. You can ask this at your pharmacist. You can ask this anyone who's helping you take care of your health. What is my main problem?
Great. So those are the most important that we should concentrate and have ready.
The second question is, what do I need to do? I just gave you a quick example. So what is my main problem? My main problem is I have high blood pressure. That's no hypertension, high blood pressure. What do I need to do? Well, you need to eat less salt and exercise more. If the doctor says to you, you need to eat less sodium, people might not get what is less sodium because I don't go home and cook with sodium. Get me the salt, please.
Get me the salt.
Absolutely.
Exactly.
So, and also, why is it important for me to do this? Those are three questions that you can take with you to the doctor's office, to your pharmacist, and make sure you use them. Three important questions. What is my main problem? What do I need to do? And why is it important for me to do this?
Great, great. This is awesome. Very nice information. And also, I see that you have a pamphlet with some of chronic diseases and what questions to ask. For example, you have here the diabetes. What questions should I check my blood sugar level at home with a blood sugar monitor? How often? What should my blood sugar, HbA1c, cholesterol, and blood pressure levels be? So this is a very nice handout that you have, and that is very useful and for everyone to have on hand, and when you go to the doctor, to know what questions to ask to get a better understanding, to be in more control of your health. Yolanda, next month, or not next month, soon, in a couple of weeks.
It's upon us.
Yes, in a couple of weeks, we'll be having an educational forum here in Reading. Do you want to talk a little bit about it?
We're thrilled. We're very excited that Gateway Health is having its first health literacy forum. Take charge of your health now. It's a health education forum, as we just said, and it's going to happen Wednesday, May 28th from 9 to 11:30, and it's going to take place at Casa de la Amistad, 501 Washington Street. I know the information will be on your screen for you to take notes. Please register. We're going to be talking about different topics and 10 ways to maintain your brain, how you can take charge of your health now. Seniors active, engage, and informed.
That's right.
And this is this is a collaboration between the Alzheimer's Association, the Berks County Area Agency on Aging, El Centro Hispano, Casa de la Amistad, and of course Gateway Health.
Yes, exactly. And we invite everyone interested. And the most important, it is free.
It is free.
It cannot get better than that.
That's right. It is free and open to the community. You will have lots of great information that is helpful for you to use. You'll leave there with information pamphlets that you can use right away.
Yes, thank you. Thank you so much,
Yolanda,
Yolanda,
it's my
for
pleasure.
being with us today. And once again, if you have any question in reference to today's topic, please call. You could call Yolanda, right, Yolanda, at 215-316-1898. And also, thank you so much. And next week, the date that we have been waiting for, Thursday, May 8th, our agency, Berks County Area Agency on Aging, will be hosting the 3rd Annual Centenarian Luncheon. And I am so happy to say that we have a wonderful turnout and a wonderful program for this year. So far, we have 38 centenarians that have confirmed attendance, along with their family, with many of the families and friends. So we are looking forward for this Thursday, May 8th, at the Inn at Reading from 11 to 1 for our 3rd Annual Centenarian Luncheon. And so if you have any question about the Centenarian Luncheon, please call 610-478-6500. And we are also looking for Berks County Artistic Talent. If you need information and would like to be part of this event, you can call Nancy Lemmerhart at 610-376-5866. I want to thank you for tuning, being part of our program today with Aging Matters. And if you have any question about our programs and services, please call us at 610-478-6500. Thank you, and we'll see you next month.